I was really impressed that our rural healthcare providers not only showed up at the office or took their healthcare on the road in response to Irene, but they also did many other kind of things that were not necessarily in their job descriptions. Tropical Storm Irene didn't happen in a vacuum. This storm affected people and communities and the entire state, and it was people in those communities who managed to prepare for, respond to, and rebuild after the devastation. Healthcare providers in rural Vermont are characterized by their ingenuity and dedication to their communities. The rural health response to Tropical Storm Irene was really impressive. We had heard stories from around the state of how hospitals and clinics and communities banded together very quickly to address the most pertinent needs hitting their community. One example of this was in Rochester, where the Rochester Health Center, while trying to open for the day, found out that they could not get their staff there, including their doctors and physicians.
My name's Gail Proctor. I've worked here through Gifford for 23 years. I'm an RN. Whatever walked through, we turned no one away. Our schedules were non-existent. It's just whatever was needed, we took care of.
I'm Dr. Mark Jewett. I'm an internist and country doctor for 35 years now. So what was done was people with their cell phones would climb up to the top of the mountain where they could get reception, report what they needed. Basically, I wrote the prescriptions, took them to the local drugstores in Randolph, and then we had either ambulance people or people that had four-wheeler type vehicles, and they were ferried over the mountain to people that needed it.
I remember one of the first days that a local woman came in and she said, "Gail, can you go up to so-and-so's house and give him a tetanus shot? He's trying to clean his house out, which he had been ruined, and he'd been cut, and he was too busy trying to get possessions out of the house to actually come down here." Went up and stood in the middle of the road, leaning against a pickup truck, and gave this gentleman a shot. And it was such a good feeling to be able to do that.
My name is Dan Manns, and I'm a volunteer EMT with Essex Rescue. We had a call from the local ambulance service that they were attending a woman in labor who was apparently a high-risk mom, had gone into labor and was in a community that was totally isolated by roadways. You couldn't get there in a conventional vehicle. Organize a swiftwater rescue team to get access to this woman and/or figure out how to get the National Guard in a high water vehicle to assist with the evacuation of this woman and coordinate meeting up with an ambulance outside of the area where she lived if we could get the Guard to move her through the high water.
Things that everybody did to pitch in, to help, was just amazing.
Mustering all of those resources on a moment's notice to be able to manage that is sometimes a very complicated technical arrangement.
But it's just, when you hear those things and you've been through a really hard day and a busy day and someone comes up and says something like that, it's like, that's why I work here.
I am Rural Health.
I am Rural Health.
I am Rural Health.
I am Rural Health.